Namaste. This is Dr. Vaishalibhide, MD Homeopathy. Today, I'm going to talk about hypertension or the high blood pressure that we all talk about. So, hypertension or high blood pressure is basically said when the force of blood or the pressure of blood on the blood vessel wall or the arterial wall is more than the optimum. That is the time we say that the person is having hypertension. Hypertension by itself is very risky or a very dreaded thing because it does not have a symptom of its own. So it is also called as a silent killer. Many a times the patients come to us with different symptoms, say arthritis or eczema, and while we check their BP, the BP comes as high as 170, 110 without any symptoms. And this is the problem with blood pressure. Unless it produces symptoms, you don't know it. But the complications of high blood pressure can be absolutely devastating. So let's see what exactly happens. When we say high blood pressure, many countries have different upper limits for the systolic and the diastolic. So when we say systolic pressure, that is the upper number. When you go to a doctor and check your blood pressure, he'll tell you 120 by 80. So there is a numerator and a denominator. The upper number or the numerator is the systolic pressure. Systole is the contraction of the heart. So when the heart contracts, the blood comes in the arteries with certain pressure. That is your systolic pressure. And when the heart is dilate or relaxed to fill up blood, there is still some pressure in the blood vessels. This is your diastolic pressure, which is the denominator, right? So both these pressures are measured. Now few countries follow different high blood pressure numbers. What we generally tend to follow is when the systolic pressure causes 140 plus, when it crosses 140, we will say that the person has hypertension now. And when the diastolic crosses 90 up, then it is a matter of concern. The normal blood pressure that we would like to all believe is 120/80. However, with the growing stress, now more and more younger people are suffering from hypertension. So let's see what is the cause of hypertension. The commonest cause is bad eating habits, which lead to obesity. Second is cigarette smoking or recreational use of drugs, tobacco. Alcohol consumption, very high and a prolonged alcohol consumption predisposes you to having high blood pressure. However, when I see patients very young, say 30 plus, having high blood pressure, then we know that the genetics has some role to play. Now, what are the symptoms of high blood pressure? As we know, many a times BP can be as high as 160 plus without any symptoms. So many a times there is no symptoms. It is a silent disease. However, when it gives symptoms, usually it comes with headache. Because it is causing a pressure on the heart, people complain of breathlessness, palpitation and chest pain. Sometimes people even complain of dizziness every time the BP goes high, and other symptoms are not so prominent. So how do you diagnose high blood pressure? We usually make the patients have 3 readings per week, and after having 3 to 4 readings with us, we will diagnose them having high blood pressure. Apart from this, they will be made to run through a few tests, blood tests, the important being the lipid profile, because that will give an idea of what is happening with the lipid status, because that will impact the health of the arteries. So what is the treatment of high blood pressure? Before we begin with treatment, let me tell you that normally the blood pressure would be 120/80. With the growing life stress, the pressure still stays there. A few times it will cross the mark, say it will go 130 up and the lower one will go 90 up, or let's say 80 up. After a few more years, a few more readings, if they have continued life stresses, if they don't make lifestyle changes, then the limit crosses and then they enter into the zone. So from normal pressure, it doesn't directly jump to a hypertension. There is a time in between where it is not diagnosed as hypertension, but it is not normal, where it has started moving out of the normal zone, and this is the best time to treat the patients because they are near the normal as yet. So with treatment, the two things we will always talk about are the lifestyle change and homeopathic treatment. Here I will mention the lifestyle change first, because if you would not maintain the lifestyle change or go to a better lifestyle, even the best of medicine can help you only little. Now with lifestyle change, the important thing is avoiding outside fatty food, your pizzas, your burgers, limiting alcohol, absolutely avoiding tobacco in any form. A good sleep cycle is one of the best ways to keep your BP near the normal range. And it is one of the reasons why your BP starts crossing the normal values, because you are not sleeping well for a long time. And with people working from home, the sleep pattern has become absolutely disturbed, even with the late night movie binges. Anyway, now we'll move towards the homeopathic treatment. As we said, we will always take a full detailed case, because there is a certain emotion which the patient has felt very strongly for a prolonged time. It could be a mental stress, it could be an emotional stress. I'll give an example here. One of my patients, she was just 40. She suddenly lost her job and she had loans on her. With that anxiety and stress, she lived for good 12 years. When we checked her BP, she was 52, 53. Her BP was 160, 94, and she had no symptom. And therefore, she had never gone to the doctor and started medicines for it. So, when we first diagnosed this, we again took 3 readings at different times, 3 days in a row. We took her full case, we saw how much the anxiety was, and then a prescription was made. Slowly, gradually, her BP started responding to treatment. At the same time, we got the blood test done to know if there is no other risk. This is how we see that what emotion that patient has gone through, which is the prolonged stress, and if there is a lifestyle change which needs to be done, and that is how a treatment is done. Here there is one certain word of caution. People come to us with their big files and BP medicines are already prescribed. In such cases, we never ask them to stop the blood pressure medication which the allopathic doctor has prescribed, because their blood pressure is in the range because of the medicine. What we do is we will prescribe from our side. As the BP becomes down, they will monitor it and then they go back to their doctors, and when they see the blood pressure reducing, they themselves make changes in the medicines. So patients themselves should never stop any medicine, because your body is used to it and the body is dependent on it. I am currently practicing in Sapres Polyclinic, Malik Building, DV Deshpande Mark, Shivaji Park Road number 4, from 10 in the morning to 8 in the evening. You can also follow me on Instagram, Facebook, YouTube. I am glad to announce that I am publishing my second book, which is titled Unlocking the Bogus Synoptic Key Part 2. This book is aimed at helping the homeopathic students and doctors gather more valuable knowledge and information for prescription in seemingly difficult cases. Thank you.